or unforeseen. And certainly by the fact that we're projecting that we have these expenses and these costs right now, they don't necessarily fall into that category. I think the only one that probably falls into that category as we look at it here would be the end of career buyouts, $50,000.
And Mike, keep in mind that, let's say, some of these things were done by reserve fund transfer.
Yeah.
Then at the end of the year, they have that amount of money less to return. So it's coming out of one pocket or the other.
Right, I just wanted to understand it. I had a feeling it, but I was really mainly leading towards the salary pool one.
Sure.
Why that didn't really fall into that, but that explains it. I appreciate it. Thank you.
We just spend a couple minutes just going through the free cash available source of funds.
Before you.
I'm sorry.
Before you go there, a couple
Please.
things. I just don't recall the discussion on health salaries that we ever discussed, that if funds became available, we would replenish that. I thought as a result of that budget discussion, we realized that there could be a cut without losing services in that department. So I don't know what everyone else's recollection is, but I don't recall
Same.
having that discussion.
Okay.
So,
Thank you.
My recollection was that we felt comfortable reducing that budget because the amount of services required was down. At least that was our understanding.
Right.
exactly.
Yeah.
I never,
Okay.
I don't recall us having the discussion if funds became available. Fire department, I think for everyone's edification, I'd like to have whoever you think is best, chief, to go through the detail in terms of those added budget items and why they're necessary or required. As everyone may know, on the recent contract, we're bringing an ALS into the community. So I think it'd be beneficial to my fellow board members as well as the whole community as to why these funds are necessary.
Chief, I assume you have the detail?
I have the detail that was sent to me. I don't know if it's the same one that you have.
Let me see.
There's people at home or people in the audience may be questioning why we're looking to add $82,000 to the fire department's
same.
budget.
Same script.
Okay. Good evening, everyone. Thank you. If you take a look at the first section, it's contractual obligations. As the town administrator stated earlier, a contract was signed that wasn't budgeted for in the 2012 budget, which increased us by $52,000 and some change. Chief Harris left. There was no budget for his replacement, so it's about $30,000 to send a person to the fire academy. Equipment is approaching $3,000, and employee benefits is at $9,000. So that brings, without adding anyone to the fire department other than the replacement for Chief Harris, almost $94,000, $521. The ALS Advisory Committee was tasked.
Bill?
Yes.
Could I stop you just for a
Sure.
second? Just to make sure we're all on the same page, in your packet, your package from the big package, it's page, page what? 52. So it's the last page in the whole packet.
Just for clarification again, my understanding, we did have money in the salary pool to honor contractual obligations budgeted.
We have 2 years, so what we have to do is we have to come up with money retroactive to July 1 of 2010, and then an amount going forward. So we do have an amount in the salary pool that is good for the retroactive amount. What this does is it fully funds the contract for this fiscal year, which was basically level funded, pending a contract settlement.
Steve, what you need to also take into mind is there was a turn back on the salary pool last year as a result of some of the contracts not being signed before the end of the fiscal year.
Continue?
Yes, sure.
Oh, sorry.
Thank you.
I apologize.
The ALS Advisory Committee was tasked on the cost of adding one new employee, one firefighter paramedic, in addition to filling Chief Harris's spot, which we're in the process of doing both right now. One new firefighter salary is $36,461. That'd be a firefighter paramedic. He would also require $30,000 to go to the Mass Fire Academy and some change, and about $6,800 in initial purchase equipment. His salary employee budget package is $9,000, which brings it up to about $82,826. We were also asked to provide some training budget process. And what we came up with for training is I just sent out that one person would be going. The program, which has not been picked yet, I budgeted for $10,000. Shift coverage would be approximately $16,000. A stipend that would be paid out mid-certification and in certification of $8,000 for a total of $34,000. And we have an ALS license for the ambulance, which is $800. Paramedic recert, which takes place every 2 years for $150. A paramedic refresher for $350 every 2 years. Medical director, which is a in-house medical director, is $17,000 a year. And equipment, $32,000 for a total of $50,300 to start up the paramedic program. It comes up to $249,647. $94,521 has nothing to do with the paramedic program. So that's the way it was broken down, tasked by the ALS Advisory Committee, and these are the numbers that were generated from the tasks that were handed out at that committee meeting.
So if I can summarize, am I correct? That's the additional contractual cost,
Correct,
the replacement as a result of the retirement of Chief Harris,
correct,
and that'll get you to zero in terms of, you have 16 firefighters at that point.
that's
And then
correct.
one additional paramedic that is to be hired.
Yep.
That's what those funds are necessary.
And all the gear associated and the training for one in-house firefighter. Because we have not picked the program yet. I've not pulled the firefighters, so I just figured for one right now.
And so
mean,
everyone is aware, we did this financial analysis probably about 16 months ago, and this falls in line with that analysis that was done with the ALS subcommittee.
So to offset the additional spending is increased revenue
Right, it's
from ALS services.
the ALS service, if we were to start January 1st to the last day of June this coming year, it's estimated that we could pull in $200,000 above and beyond what we have right now. That's an estimate. We called Middleton today, and they run a similar service as we do, and they made $400,000 extra last year, about the same. We probably have more runs than them, but we're a similar department. So, I mean, if you look at the historical data of what's happened with the communities surrounding us and ones that we pair up with well, we're on board to follow exactly what they're doing.
Just a question on the medical director. You said it's an in-house?
Yes.
It's actually an outside person.
That's I guess the way to explain it is we get our medical direction from Merrill's Wakefield Hospital, Dr. Walker, and he would subcontract that out to someone that he's comfortable with, and they would be working with our ALS coordinator to develop the advanced life support protocols and procedures, go over any issues that we have, and make sure that we're moving in the right direction.
Thank you for clarifying that.
Any other questions for the chief?
Just, Chief, you said that you were figuring for one in-house coordinator, one in-house person for
Advanced life support coordinator, ALS coordinator, yes, sir.
what? Okay, at this time, were you thinking about,
No more than one.
so I thought, you said, yeah, so I thought it was one, but I thought you said we just,
Well, we're talking two things here. We have an in-house medical control doctor, which we have to have,
Right.
and we will have an ALS coordinator
Yep.
that will work with myself, Captain Galvin, the medical director, to deliver the best program to the citizens of North Reading.
When, just for the benefit of the public, I know it's maybe too early to put an exact date on starting ALS, but what's the target?
I believe our target's December 1st.
Somewhere between December and January. It's the licensing process that takes the most time, but I've already contacted the state. I have the 2 letters. I have the license filled out.
We're ready to go.
And he and I, this gentleman and I work very well together, so he's gonna push it along as fast as he can.
Great,
We're ready to go.
thank you. Mr. Chairman. Mr. Yule,
You mentioned that if you started January 1 from 12 months, that saying it correctly, profit $200,000?
That is correct. That's an estimate from our billing company, and it's also backed up when we spoke to Middleton. And, you know, based on historical data, that's what we're looking at.
Even if it's a little bit less, or a little bit more?
Could be more, could be less.
I understand
There's,
that.
you know,
For the benefit of the public, what's gonna happen with that money? I mean, that's it's a lot of
hopefully
money.
we'll be able to fund some things through the fire department without going through them. I mean, it's a revenue generator. We want to make sure that we're able to deliver the best service that we can and hopefully pay for it as well.
Those funds,
those funds go,
Designed to stay
those
within the
funds
fund.
go to an account, the ambulance account, which is currently in existence, and funds a portion of the fire department budget, and in addition to raising capital for the replacement of the ambulance.
Training,
on a
equipment.
regular basis.
that's good news.
Any
Chief,
other
thank you.
questions?
Thank you.
Thank you, very good.
Thank you.
Greg, go ahead.
There's, if you look at the breakdown that's shown here, there's another item that we had requested.
This is going back to the original.
Go back to the original sheet.
Okay.
So Article 5, we had shown that there would be,
Back to the supplement, you mean?
yeah, go back to the supplement, my
Greg,
apologies.
while you were pulling that up, if I could just ask one more question on that section. before
Of
you go
course,
on. The town building master plan,
right.
$26,000. We have an estimate when that's gonna get done?
No, I don't. It has to be, we have to have a contract signed by the end of the fiscal year. So I would talk with Dick. We already do have an architect that we have contracted with, so we don't need to go out to bid. We do not need to do a solicitation of proposals. It would just be a matter of reviewing with that architect his availability and what our schedule is for completion of the project.
Dick
Okay,
is here.
if you could just ask the benefit for it, you know, the rationale why we're doing it, and the benefit to the town,
Dick?
and maybe an estimated completion.
Heidi's probably in better position to answer that question.
No,
No, it's a
no, no,
different-
this is Dick. This involves the public building master
Oh,
plan.
public buildings, I'm sorry.
Different.
Good evening. I have the proposal from the last time we submitted this, and they estimate about 4 months from start to end for the 3 buildings I originally asked for. We've added 2 more buildings, so it would be a little bit longer. The rationale is most towns have piles and piles of documents recommending this, that, and the other thing, which, from my perspective, recommending to you what we should do and the taxpayers is kind of useless. This is to distill all that stuff down into very short, 5-page or less, prioritized things we should be doing for our buildings. That's the gist of it. Most communities, just like North Reading, we have rows and rows of reports on our buildings, which are just basically paperweights. Trying to distill that down to useful documents that'll help me recommend things to spend within public works, or ask for requests for other people, or get money from the outside. If I have a prioritized building plan, Maya likes that, our insurance company, that shows we're actually thinking ahead, like our roofs and things like that. And possibly, since our building's historic, that would perhaps help us get money from historic, like the federal government.
Dick, there have been a number of studies, and one of the more recent one was the energy study that was done on all the town buildings, including the schools. Will that information be available to the consultant?
Right, that, the power use is just a subset of what I'm gonna
I
do.
understand that, but I mean,
Those reports were done very, very high level. As we got in some of the energy conservation projects, we found that what they estimated for something was way lower than what it should have been. For example, the variable frequency drives we put in at the bachelor school, I believe they quoted a price about $10,000. It really cost close to $25,000 to do it. So sometimes those numbers, you have to take them with a grain of salt. And additionally, as part of the energy conservation program, now that we completed 3 phases, now we're gonna keep looking at, all right, did it make sense? Do we actually save the money we thought we were gonna save? So perhaps, even though going green and saving the money, going down that path might sound great, if we don't save money, then it really doesn't make a lot of sense. So again, it's to allow me to better manage the facilities, to better use the funds that are available, and to hopefully take advantage of external sources of funds.